right. Thank you everyone for coming. We basically decided, I'm Rachel Schumacher. I'm a consultant and have been working to support the ECFC group for a couple years on the Raising Childcare Fund, but more recently I've started working with ECFC around supporting all the activity that's been going on and all the it started out of some collective angst that sort of was expressed after the American Rescue Plan was passed, when people sort of thought, wow, we've been working so long to get this money. Now what? How is this going to get implemented? What are we going to need to do to support the folks that we work with in state and local government, as well as obviously there's ongoing efforts happening at the federal level? And how will we both share expertise across ECFC members and share our wins and look for advice and consolation on things that haven't been so easy. And so as a larger committee that included national and state funders, and Carol and Shana and Madeline, who couldn't make it today, have been involved in that. And we just decided it was time to do something that was just for the state focused folks and local focused folks, because there's very different nuts to crack going on. And you guys are up close and personal and have really great working relationships with people in your state or city, and Shana works at both DC and I think in Maryland. So we thought it would be nice to make a space for just some sharing in that vein. And we'd also been noting some positive things happening. I know in Connecticut, they're one of the first states to get their stabilization fund application online. And Madeline, who couldn't be here, just posted some things that they had done. DC just did some stuff interesting yesterday, although or 2 days ago, although we were just discussing they're actually going to try to raise taxes, not just use the federal dollars. So we thought it would be nice to have an opportunity for you folks to share with each other and to talk about whether, and see what, yes, Elizabeth Gaines says, woohoo, DC win. So Shannon, did you want to say anything since you're here, or should I just keep powering through?
The only thing I would say is that earlier today I sat in on the philanthropy roundtable of child welfare funders that is convened by Casey Family Programs, and we meet monthly now. And I go, and Brenda Blasingame, a few other people from ECFC. One thing that was really interesting was hearing how the child welfare situation is very analogous to the situation that we have in sort of the ECE space. And I mean, those aren't distinct spaces, obviously. I think a lot of us feel like if you're working on family support or you're working on early childhood mental health, you're working on child welfare prevention. And I bet some of you, maybe Klingenstein with the focus on mental health, or Nicholson, may work on both spaces. But the whole sense of there's so much money that the public officials are kind of gobsmacked by the whole thing and like how to most effectively help. There were so many direct analogies, actually. And I think that, it was reassuring to hear that to some degree, the kinds of things we're already starting, like this, which of course we want to make this as effective as possible, are already a little bit ahead. They're trying to think like, what do we do? What could we do? So that's all.
Yeah, so we started meeting pretty quickly in April, the subcommittee, and we generated a memo for funders around how what we saw as the main themes and issues, and what a theory of change would be around looking into making this opportunity more of a permanent transformational change to the early childhood system rather than a one-time piece, which we kept hearing, this is one-time money. And then we also put together, or I channeled Carol and Madeline's ideas into a tips for state funders document that we've put out. But now we thought, hey, it's time to sit and reflect and make a space. So maybe we could just do a sort of a round robin, and I thought I'd start with the folks who I prepped to be to kick off, which are the two folks on here who've been part of the ARP subcommittee working group for a while for ECFC. But just to share, you know, obviously your name, where you're from, and how you've been sort of involved in what's been going on and implementation in your state, and any lessons learned, or, you know, things we can all cheer you for, and things others might want to weigh in and say, oh, that happened in my state, here's how I handled it. So we just love to have you kick that off, and I thought I'd start with Sheena.
All right, thank you, Rachel, and thank you for inviting me to be a part of this conversation today. I'm from the Bainham Family Foundation, which is based in Bethesda, Maryland, but primarily does a lot of its place-based early childhood work in the District of Columbia. And so I think one of the first things that I'd point out is we really tried to think about all of the lessons learned from the initial relief dollars. And so this was something that was a collaborative effort inside government with the Office of State Superintendent of Education in DC, particularly our Assistant Superintendent of Early Learning, Sarah Mead, and also with practitioner-led organizations like DC Association for the Education of Young Children and DC Family Child Care, and some of our advocates that are really focused on the revenue side of the work under 3DC campaign. So a lot of people, I'm trying to just give you a taste of, a lot of stakeholders came to the table and they said, this is what worked in the last round of relief, and this is what was a challenge for us and was problematic. And, you know, it was kind of a negotiation between outside government partners and government to really say, okay, yes, that was a challenge. We recognize that we can do better on that component next time, but there's some that, you know, this is just kind of the situation we're in and we can't really change it that much, but we understand the pain point and we'll communicate a little bit better so that you'll understand what's going on. So that's the first lesson learned, I'd say. So I think we've talked about this on the ARP committee, just the challenge of lag time with distributing the emergency funding. You know, we're so excited that it's here, but then no one sees it for a while. And, you know, I think one of the things that was identified was the need for intermediaries to distribute that funding. But in DC, what we're recognizing is we can't just have one, we have to have multiple, because it's so much money, and we want to also be intentional about the different purposes of the funding. So we're needing multiple intermediaries. And what we're doing as funders is really trying to step in the gap in terms of helping with technical assistance and communication in terms of understanding the landscape of funding that's available, and then educating trusted members of the community. Like I had mentioned before, like some of the practitioner-led organizations like DC Family Child Care Association and DC Association for the Education of Young Children. And we also have like an education fellowship program here in DC out of Educare. And we really are trying to empower that group to really be able to share information with their colleagues about the many different funds. And then the private sector, or the philanthropic sector in DC has also tried to fill in gaps of funding. Like if we knew we were going to have some time to wait before ARPA is distributed, can we put out a fund to fill that gap for the time available? Also, there were just some like really, this is like in the weeds, but very like serious health things that we needed to fund, such as in terms of infrastructure, like a bathroom on the first floor for home-based early childhood educators. So we created a separate fund. Definitely doesn't have the name bathroom fund, but it's like a fancy fun early learning quality fund, but it's really for that primarily. And then the last thing I'll talk about is our policy advocacy work. We've been funding policy and advocacy work in this area for about 8 years now. And we really took a grassroots strategy where we're funding, the traditional nonprofit advocates who, know how to maneuver in savvy ways in terms of communication with government officials and policymakers. And we also funding, grassroots organizers who know nothing about early childhood, and we're funding practitioner-led organizations. And it's kind of like we're putting all these three advocate groups together to really try to, make something great. And we're trying to make a secret sauce, I guess, but really making sure we're investing in just the infrastructure of policy advocacy work in DC, which was sorely lacking in comparison to other areas of the country. And so that work really has started to pay off and has been paying off. Not only are advocates able to ensure that the funding is, distributed quickly and in line with the congressional intent, as well as meeting the needs of early childhood practitioners themselves, because practitioners are at the center of our advocacy work. They're also able to, really be, have that line of communication open with policymakers so that, they can negotiate, different, regulations that are coming down the pike, as well as just talking about pain points and having open discussions about pain points. So that's been happening as well. And then the last thing that Rachel already alluded to was a couple days ago, our advocates have, done a lot of work, particularly focused on the DC Council. And they, to the point where, everyone on the DC Council knows about, all of the issues in the field of early childhood education, which is so important, given all of the other social service issues that are, at play in the district. But the other piece of it is our advocates really worked with other groups, like groups that were fighting for homeless services, for instance, to really make sure they were kind of sharing the win in the advocacy work. And so 2 days ago, a tax increase for people making $250,000 would have to pay around like $300 more in taxes, was passed 8-5. And so this part of the funding will go to increasing salaries for early childhood educators in the District of Columbia. And some of the money will also be going to earned income tax credits. And then another portion of the funding is going to support like rapid housing services for those experiencing homelessness. So it was a very much so a collective win. Although the caveat to that is it still needs to be signed by the mayor, and there's some other hurdles in DC that other states don't experience. But we're pretty optimistic about this advocacy work, and in terms of the compensation, which has been a huge pain point. And then Rachel did mention, why now when there's going to be a flood of federal funding coming into the district. Really, the argument that was made by advocates is basically the one-time money argument. This is one-time money. We need to be thinking about this in a more sustainable way, and we want to make sure that our early childhood educators are supported in the district. Okay, I hope that's all I have. Rachel, I hope I answered all the questions that you sent to me, but happy to answer any questions or clarify anything.
Sure. Does anyone have any clarifying questions for Shana before we go on? I think it was a really interesting point that you made, Shana, that you've been investing in sort of layers of the ecosystem in the city for years and years, and now it's sort of paying off. And especially if you have a situation where you were able to build a cross-sector coalition to pass that tax increase, that is part of what doing that kind of work does. So that's exciting. Hopefully the mayor will sign this. Shannon has a question.
Yeah, I just have a question about the intermediary strategy and kind of wonder if other people are also thinking about intermediaries. And you mentioned needing more than one. Interestingly, on the child welfare call today, one of the pieces of there's been massive numbers of child welfare, investments in all the relief packages too. I didn't even realize how much. And a lot of it was supposed to be able to result in more money going directly into the pockets of youth aging out of foster care. Like I think 18 to 26-year-olds, but there's not really a mechanism for getting that cash out. So they were talking about like, we need intermediaries who can distribute this cash to youth aging out of foster care. So I guess my question for you is, how is that working in the district? I'm on the board of an organization in Virginia, and the state literally could not get the money out. Gave it to the organization I'm on the board of. We had to totally reconfigure the staff to be able to give out money to providers, and then the state paid the nonprofit back late, like expected the nonprofit to be able to front millions of dollars. So, which we did, it worked.
I think
because we've got a great director, but.
One of the good things around that DC had in term, kind of had a head start on is we already had, an infrastructure funding in the district, and it was, a privately funded and publicly funded. The privately funded fund came first, and then the mayor did a public fund. So we already were working with CDFIs to distribute infrastructure funds. So it was really just tapping back into those same folks to distribute funding who had already built relationships in terms of helping a provider get an architect, helping them think through like how they're going to, what are the trade-offs if you decide to redo your entire basement versus the outside playground area. So it was kind of like those relationships are already established. So it was easier to trust those intermediaries. And then we added another intermediary that is called WAKIF, and they're Black run CDFI. So that was really good in terms of like thinking about things from an equity standpoint in the district, and they're DC based. But I guess the main thing I'd say is I think we already had kind of a head start on that because we already were using those intermediaries, and DC is so small at the end of the day. It also probably has to do a lot with like actual geography in terms of like that relationship building. People aren't applying if they don't have relationships, and people are also like, even though it's a lot of money, they're like very skeptical and weary, and so they really need like an interpersonal relationship with someone. That's also one of the reasons why we brought in the practitioner-led organizations. And our assistant superintendent of early learning kind of gave them a sneak peek of what was going, but not, all of the details, because that would not be, ethical, but some of the information so that they would know, so that they could then help get the word out about these different funds to the community. Which is why we've had like 90%, participation in certain grants, upwards of 90%.
I hope somebody's going to study that, because that happened in St. Louis City and St. Louis County with PPP too. It was like the city made a really, concerted effort to get people that were trusted resources for providers to be the ones going out and helping them fill out the paperwork. And the county just like put it up on their site and said, please apply, and it was just night and day in terms of somebody should study that.
Interesting.
We've actually done something similar in Connecticut. We have the entire state is covered by staff family childcare networks, which is something that we started. The Funder Collaborative started with our Connecticut Office of Early Childhood prior to COVID in an effort to provide more support to family childcare providers. And when COVID hit, we immediately, the Funder Collaborative stepped up and, working with the Connecticut Office of Early Childhood, launched additional staff family childhood networks so that every community is covered by one. And I'd like to think that we were prescient, but I think that we were just lucky in the fact that when COVID hit, and now that we have these stabilization funds, to Shana's point about the trusted intermediary, was very important for those family childcare providers to have someone else to say, it's okay to accept this public money, because this was the first time that family childcare providers were getting direct funding, not through childcare subsidies, but getting direct funding from state government. And there was skepticism among particularly some of the immigrant communities and others. So having those intermediaries, as Shana pointed out, was essential for the uptake that we've had in our state. And then also I want to also point out that for Connecticut, our Connecticut Early Childhood Funder Collaborative, to the point that was made about the difficulty in terms of getting even federal funds out, the state of Connecticut actually provided funding to the collaborative, 1.25 million, to get out to local early childhood councils. So that becomes the other hat I wear in terms of managing those funds. And once again, it's a trusted connection because we've been involved working with those local early childhood councils for many years.
That's great. Carol, thanks for jumping in. And I just, is there anything more you want to add about sort of your experience in Connecticut, unless anyone has a question for Shana? I think we're ready to hear about some of the things that you've been working on in your state and your experience.
Shana's touched on a lot of them already, which of course, I think the number one, of course, was the initial outreach. We have a very visible, active commissioner for the Office of Early Childhood, Beth Bai. And so immediately there was outreach to providers, parents, family childcare providers were given more equal voice in this, philanthropy and others in terms of how, so Connecticut, our application is out there. We've had an uptake of 85%. And so we're very happy with the rollout, but I think a lot of it was because, as Shana mentioned, we learned from the first stabilization dollars, what we called CT cares, in terms of what worked and what didn't. The fact that we had these intermediaries that we could get the information out, both through the staff family childcare networks and our R&R system, our United Way of Connecticut. The other thing that we all advocated for in this particular group of funds was also around equity. And so working with the Office of Early Childhood, we are using the Social Vulnerability Index because we had already done an identification of where the child care deserts were. So if you look at the Social Vulnerability Index, it's basically 15 components. We were then able to map out the state in terms of where providers and communities fell above and below that line. And we're already beginning to see that the use of that is bringing more parity to providers in poor, generally minority communities, in parity with more affluent white communities by using the Social Vulnerability Index as one of the components in terms of the bonuses that go with the funding. So there's basically a basic rate that is being used, and then there's a bonus for accreditation. There's a bonus based on your SVI indicator. There's a bonus if you're already taking child care subsidy funds. And I forget, let's see what the fourth one was. Oh, if you were open during the pandemic, the peak of the pandemic. So all of those, but the Social Vulnerability Index has really helped to address that, that equity issue. In terms of philanthropy, similar to what Shana mentioned, it was important for us to work with advocates. Once again, grass tops, grassroots in terms of providing input. But as I say, I think the plus for us was the fact that we have a very open partner with the Office of Early Childhood who really took in all of the comments they got from many different sectors and many communities. Philanthropy stepped in terms of assisting with outreach, technical assistance, both through new funding as well as our existing funding through the staff family childcare networks. I'd say I think there are basically some guiding principles that we had to this, which was simplicity, flexibility, benefit of the doubt when working with providers, listening to them, because especially when you're talking to family child care providers, it's so unique in terms of what their situations are. So a little less of a compliance emphasis than state government usually has, and then intentionality in terms of settings. So really this has brought some equality between traditional center care and family child care. So that, as I say, we have an uptake of about 85% at this point. And that's only been, the applications have only been out for a few weeks. Similar to what's happened in DC, where I used to live and my family and grandchildren live. So I was happy to hear about what you've done there. And I'll be bringing that back to our advocates here, Shana, in terms of that tax increase. Our legislature, because of the work of advocates and providers and philanthropy in the last session, did increase the child care subsidy eligibility from 50 to 60% of state median income. So that goes hand in hand with this. They will pay parent fees as part of the child subsidy through November. They're paying summer fees for preschoolers. And there's now a permanent 25% bonus. These are state funds, not federal funds, for accredited centers. So that was where we did fall down, is we sought an additional $10 million for child care centers in the last budget, and were not successful. They just couldn't get it through, understand that all they heard about was all of this federal money. What they didn't realize is that this federal money is now being spread across family providers as well as traditional centers. All they could think is, we've got these millions and millions of dollars. Why do you need an additional $10 million? So we were not successful there. And that's an area that we're going to have to work on in the next session. In terms of philanthropy, interestingly enough, and Elliot can attest to this, we just met with our Office of Early Childhood today in our Full Funder Collaborative meeting, and asked them, going forward, how can philanthropy help, in addition to policy and advocacy, support for policy and advocacy, technical assistance. And the areas that came up were evaluation, particularly as it pertains to equity. So what were the impact of these federal dollars in terms of what was their impact overall? How did it address equity? And how is it beginning to position our system for the restructuring and reimagining that's needed going forward? The second area is another area that philanthropy has been very active in, is in parent voice. But how do we sustain parent voice? Not just, one time because of the dollars coming in, or one time because of the pandemic. How do we sustain that and build it? And then the third area was thinking about, particularly as we have federal legislation that may be coming through in terms of universal pre-K. What does that mean in terms of our system? In Connecticut, before the pandemic, we had a gap of 50,000 infant toddler slots, not unusual compared to the rest of the country, but we had documented that. But what will universal pre-K mean in terms of parent choice, in terms of, and as I say, the impact on infant toddler? And then finally, the area, of course, is around workforce. Where the funds are being used, 97% of those who accepted the funds are using them to increase staff compensation. But of course, the concern is when the cliff comes. So how do we think about that? And how do we think about compensation more broadly, and not just salary? Thinking about healthcare benefits, thinking about other supports, and particularly when we're thinking about family child care providers, how do we start thinking about, joint purchasing of health benefits, et cetera, which are things, areas that have not been addressed. So with that, I'm happy to answer any questions. But as I say, I think a lot of our experience reflects what Shane has done. Once again, congratulations to DC for getting that through, because that begins to address, a permanent solution to the salary issue.
Thanks, Carol. Does anyone have any questions or reactions, reflections?
I'm curious if, and Shana, I don't know how much it was known by council, but in DC, but they had a big number. I mean, whenever I talked with Kim Perry, she knew, like, 250 million a year is the big number that we're socializing, like that, or whatever the number was, something like that, right?
Yeah.
Like that's what we need, and that's what it's going to take to do this well. And so even though there was all this big money coming in, you could still sort of say, look,
right. Yeah. I mean, well, DC just has to do a fiscal impact statement when they pass legislation. And so she had that, as well as one of her partner organizations, DC Fiscal Policy Institute, literally was like tracking each piece of the legislation in terms of the funding gaps. And so because we had so many conversations before all the money came, they were able to really talk about, this is how far off we are in terms of like long-term sustainability. And this is why there's an urgent need for this now, to collect these taxes now for when there is a cliff.
I had a quick question too, which was Carol. You talked about using the CDC Social Vulnerability Index, and that you mapped out the state. And I just got a little confused. So you awarded bonuses, or the state was awarding bonuses and stability grants based on where people live. Was there any sort of prioritization, or are you still trying to reach all the providers in the state, or was the money prioritized to go to areas with a lot of vulnerability on the index, or anything else like that?
It was, I mean, to reach all the providers in the state, absolutely. But in terms of priorities, it was to reach those in underserved communities, because we had just done this mapping in terms of childcare deserts. And so an overlay of the childcare desert with the social vulnerability index aligned almost perfectly, quite frankly. And so in most instances, it was some of our rural areas, but most of them were in our urban areas. So that's where we're using the bonus funds to provide additional support to them so that they can serve more children in those areas.
And didn't you also do something, Carol, around compensation, or saying some amount of it had to be used for salaries? I'm not sure if you touched on that and I missed it, or.
Yes, we are asking through the stabilization funds that they provide the bulk of it to increase compensation or for salaries. And as I say, 97% of them agreed to that. And one of the things actually we talked about today was, what about the other 3%? What's going on there? And what I didn't realize is, because some of the programs are in public schools, you've got union contracts and they can't give increases to some and not to others. And so in most instances, the 3% that did not take us up in terms of that were because of contracts and other reasons.
All right. So what percentage said that they would do it?
97%.
97%. Okay.
97% agreed to use.
That's amazing.
Bulk of the funding for salary increases.
Yeah.
Or no, stipends or bonuses, I shouldn't say salary increases, stipends or bonuses, or however they decided to structure it. 3% did not, because of, as I say, in most instances, school districts, union contracts, et cetera.
And so, there's all this effort people have been talking about. We want to make long-term differences in compensation. So when you guys were talking about this, I'm sure you weighed that and decided that this was the best mechanism to put out the resources, given the budget and how long you knew you had money and all that. But was that part of the conversation, or, I remember Commissioner Bai talking about this, but I don't remember exactly how she answered, in terms of, we're going to do it as this bonus thing and sort of encourage providers to do it, but we can't actually tell them exactly what to pay their staff. I'm just curious if that.
Oh, no, there's no question.
Yeah.
We're not telling them what to pay their staff. That was not part of, and the additional 25% bonus that I was talking about that the state legislature approved, there's no strings attached to that. So if they want to use that for equipment or what, there's absolutely no strings attached to that. This was for the stabilization dollars. And as I say, 97% decided to use, some of the funding, not all of the funding, but some of the funding for staff bonuses or stipends or et cetera.
Great. Anyone else have questions or reflections? It's an amazing amount of work that you all have been doing. So there's other folks on
Most
the
of it's
call.
yet to come, Rachel.
What? I know there's more, always more, it never ends, but considering the timeline of the money coming into the state, you know, not very many months ago, the fact that you engaged a company to help you, right? Third sector, or was that Massachusetts and you guys shared that
We actually had
contract
third sector and social finance partners have both been working on us.
on the equity?
As I say, a lot of this was had been work that we had already begun with the Office of Early Childhood. So
Okay.
similar to what Shana has said, I mean, some of it is we were just moving on from there. The challenge going forward, of course, will be the sustaining dollars for the workforce compensation. That's really the major issue, as we all know. I mean, that's no surprise.
Mm-hmm.
I'd be interested, Shane, in your when you were talking about the gap in terms of the 250 million needed. One of the things we're still working on in Connecticut is calculating the true cost of care, of quality care, and the Office of Early Childhood is working on a survey and other ways to talk to providers as to what are the real costs and the real cost of quality care, not what are they spending now, but what, to really provide quality care. And then also looking at, what are those other sources of funding? Because some of them are philanthropic sources that could go away. I have some community foundations that are providing general operating support. That's not true for every community foundation in terms of providers. So I'd be interested in how you calculated what the gap was in terms of what you needed.
Yeah. Well, so the fiscal impact statement really was calculated by government. So it was calculated based on all of the components of the legislation, in which funding for early childhood was just one component, with the goal of reaching universal childcare, since DC already has universal pre-K. And I can't remember the exact amount of time right now off the top of my head, but over time. And so the fiscal impact statement helped our advocates know like how much money we would need to raise each year to achieve that, that end goal, where families were only paying 10% of their income to access quality early childhood programs. So that's how that came about. And then DC has used cost modeling as a part of their Child Care Development Fund state application for a while now. Now I think we talked about this either on the finance or the early Childhood Funders Collaborative Finance Committee or the ARP committee. I'm confusing committees now, sorry. So Shannon or Rachel, if you know, please jump in. But we talked about, cost modeling and all of the inputs and what does it look like to have an equitable cost modeling, because you can do cost modeling and you can have a whole bunch of assumptions in there and inputs, and they can not be equitable. And they could not really encompass all of the different costs of care, of high quality care. So that's something that I think in the field generally, we're going to have to continue to work towards, and really work on having all of the inputs, because I really haven't seen one that has all of the different costs and inputs in it to the degree that it needs to be. And yeah, and kind of like the struggle that you mentioned between the current reality and where we want to go aspirationally. There's, cost modeling, we want it to be feasible, but we also want it to be aspirational at some point. I guess it's like the push and pull of, government, what we can do, and advocates' hopes and dreams. So cost modeling is like a very political document. And we have a lot more work to do on that as a field in general.
That's a really good point. And I would just say that having recently been with a lot of family childcare providers, they were raising the issue of what salary do I put in for myself in a cost of care, like that becomes very political. And one was in a state where they were basically saying, this isn't about your salary, it's about the cost of quality. It's like, well, if I'm not getting paid enough, it's hard for me to provide quality care. So I wonder, Christine, would you like to come off mute and share some of your experiences? I pick on you because you're the only other person who has your camera on.
That'll teach me to keep the camera on.
Right.
So I'm Christine Thorstensen. I've met some of you on these calls before. We are a relatively new member with the group. So I'm with Silicon Valley Community Foundation. So as Community Foundation, we're pretty place-based. We're very much centered in San Mateo and Santa Clara County in California. And I hopped on this call today because I was hoping that there might be somebody who could shine some light on California's situation and use of the federal relief funds, because it seems to still be pretty murky waters when we're trying to get some clarity. It has been a tremendously exciting budget and legislative period in California right now. And we have an incredible state surplus, and really for the first time, tremendous champions for kids in office. So it's a little overwhelming right now for a lot of us to even understand, on top of all the federal relief funds, all the state funds that are coming our way, and including an expansion to about 200,000 additional childcare slots. Reimbursement rates are being reset. Believe they finally agreed to 75% of the regional market rate, which is really great to have like one consistent, because we have multiple different streams. And we're going to have universal pre-K because we're rolling out our transitional kindergarten program over the next 5 years, and planning year, and then 4 years of implementation. But yeah, and a lot of that state budget is including and using the federal relief funds. So it's been a little tricky to understand, like, well, is that state funding or is that the federal funding? And as of now, and I've had lots of conversations with local folks who are like, where's the application to apply for stabilization funds for our local providers? We aren't at that point yet. So if there's any other Californians on this call who have some information, I'd love it so I could take it back to folks. The way we did a lot of the money was the first round earlier funding, it went directly to the counties, a lot of it. And then the counties were able to determine how much of the CARES funding was being allocated to stabilization funds and different providers. And we did play a role in how to get that out to the community. And we used intermediaries definitely in how to get the word out, and CDFI's different low income investment fund, with some folks were using, and other community groups in order to take in the applications. We found providers, just like you shared, were very nervous and uncertain about how to apply, and were really questioning the fact that this was just money, and you can't really, you're just giving me money, that would be okay. So it took a lot of hand holding and support, and we were able to provide a lot of that. So, I'm really curious to know, when we go back right now, we've been asked, at least locally, to come up to report back to our Board of Supervisors in both counties with some lists of what are the priority needs. And as these additional funds come into the county, how should we distribute them? And really thinking beyond just direct cash supports for providers to what are the underlying systems we're going to need. So where can we be investing in workforce development? We have a huge shortage. I'm sure it's a shortage across the country, but here it's just, we can't find staff. People have double-digit openings in their centers trying to find people. So where can we recruit? And so that's kind of where we're at. So I came on the call today to really be like, is there some insights for me? Do other folks have any ideas of what we can expect? And it certainly sounds like Connecticut and DC is much further ahead in moving those federal dollars out the door, which is good to hear. So maybe we'll see that soon. So I don't know if anyone has some insights they want to share.
One of the things that's interesting to me is that you guys talking about using CDFI, several of you, and I think that they're great. I've been really interested in them, but I've also been really interested in how we could use the stabilization grant process as not an exact template for changing the system to be one that's more like Head Start where you give grants to everybody, but like to get closer to that. Like, I mean, you probably have to have more accountability than you do with the stabilization because the rules around it are pretty flexible, but that'll be interesting because CDFIs were not in my mind as the group that you would turn to like change the entire way that you fund the system by giving out grants. Whereas maybe R&Rs might have been in my mind as a group that you could start to give them big chunks of the CCDF. They do eligibility already in a lot of places, and they know the providers. Could we just basically ask the states that, not ask, but would some states just outsource to them and say, we're going to start buying classrooms and we're going to start buying programs at the rate of X amount per kid for the whole program. And, you know, I think people would have been like, no, there's no way we can do that. But you just did the stabilization. So if you just did the stabilization, you know, will that increase comfort level to do that going forward? I don't know.
So, you know, just on this R&R as versus, not versus, but and CDFI kind of pros and cons. I mean, what I often hear from folks in the shared services world is like the staff in R&Rs don't necessarily have the financial business understanding and capacity to really be that kind of support, especially for family childcare, which often need like full-on business. They can, and it can be built there, but you can't just assume because they do eligibility and have coaches that work with providers and stuff that they necessarily have sort of the business mindset that like a CDFI or the financial training. So that's one reason that people have been turning toward CDFIs and sort of bringing them in to the mix. Maybe they don't have early childhood knowledge though. So they're trying to figure out who the right people are. And I was wondering, Carol, if you had anything to say about this, because I know when you guys were doing the family childcare networks, Connecticut did an RFP and, you know, was sort of trying to understand like, who are the right people to be the intermediaries? Because basically that's part of what you're talking about in California. California is so big. Even the first fives are big. You need to really drill down into communities to figure out what's the trusted entity and who could be the intermediary, because otherwise it's really hard to find people. And I bet there's a lot of home-based care going on that nobody knows about in California, and there's a lot of need to think about how to better build the pathways to those folks and integrate them into the system and sort of make some decisions about what that means, because I know you have a lot of care, a lot of folks, you know, want home-based, want their family, but then what if now they decided they've been home for 14 months and they want to actually have a business? Is there any way to help them do that? So I do think California did actually do some investment in family childcare networks built off their first five system in the with the PDG dollars, but I might be remembering that wrong. But there, you know, there's a model of doing that kind of stuff. Just hasn't been taken statewide.
Yeah, I think you're right, Rachel, that there were pockets of investment through the first fives, but California, again, it's so big, and it just, sure, that happened in some first fives supported it, but others, like I can say in San Mateo, we do not have that network and we are desperate for it. And so we're constantly reaching out and trying to make connections and find those trusted partners. And for so many years, we've underfunded our R&Rs that they don't have the capacity. There has been times in the past where they have had like a business navigator and somebody who could help people as they go through a licensing process and things like that. And that money dried up many years ago and they don't have it. And so to turn it around that fast, they're a bureaucracy. They couldn't staff up quickly enough to do it. So we turned to other, now with our R&R in strong partnerships. So, and so I do think part of our moving ahead and our push at the state level, and it's in our budget plan, is you've got to start funding the local planning councils properly and the R&Rs properly so that the infrastructure is there and we're not relying on, you know, this like disconnected network of people who are pulling things together, because it really should be, for us, at least in the way California system work, it really should be our R&Rs and it should be our local planning councils, supported maybe by our first fives who are leading this charge. And a lot of them just don't have the capacity.
In Connecticut, we kind of did a both and our R&R, which is our United Way of Connecticut, And then for the staff family childcare networks, and this goes back to, once again, before the pandemic, philanthropy and the Office of Early Childhood brought in what a nonprofit, the Women's Business Development Center. And they have that financial expertise, business management, acumen, et cetera, to work both in groups and also individually. And that was key, because that's not something all the staff family childcare networks. We're fortunate in that all our kin was born in Connecticut. And so that's the major staff family childcare network now in Connecticut, and is also branched off to other states, including New York. But for some of these staff family childcare networks, particularly in our rural areas, they were family resource centers where they may have the connection to family providers, but they really did not have that expertise. So by bringing in the WBDC, or Women's Business Development Center, it added that component to it.
Yeah, the only thing I'd add to that is, you know, it's really good to have someone who's seen as kind of a neutral arbiter to distribute the funding, rather than someone who's already embedded in the system and already has a role in the system. So if your role is coaching and evaluating, like, you distributing money also becomes kind of like problematic in terms of building trust, versus having a CDFI who's just, this is the only thing we're doing. We're leaving you alone. We're giving you some advice. Here's your money. Now go talk to your quality facilitator, your coach, your, you know, whoever else.
Carol, when you brought in the Women's Business Development Network, were they able to support programs across the state, or were they in specific regions? Like, was it something consistent, that tools that were rolled out?
Basically in tiers, Christine. I mean, they did initially, particularly at the peak of the pandemic, we're doing mostly webinars and small group issue specific. And since then, they've been able to do more individual. The other thing is we're trying to also move to for lack of a better word, kind of a train the trainer model. So the staff of those family childcare networks, if they can begin to at least answer the basic questions, or to be able to refer providers to resources, and then if there's a need for more intensive help, then we have the WBDC. And also, I should add, all our kin is also a part of that. So we've been pretty much able to cover, but this is at one instance where it's good to be a small state.
Elizabeth wants to know if anyone knows, do they have their R&Rs working with CDFIs in a more formal, like, work together kind of arrangement? If no one here knows of one, I would suggest asking Louise Stoney, because she does so much work on sort of putting together shared services models. She might have an example of how that, of someone trying that.
We're beginning to explore that here in Connecticut with LISC. But it's not there yet.
Yeah, we're kind of doing the same thing between the Early Learning Quality Fund, WACIF, LIF, and some private dollars, and the CCR&R, really just where is funding going, just mapping it out and making sure, you know, the private dollars are also mapped on, just so that we know what areas we're solving where in the system, and whether they're short-term solutions or long-term. So that's one of the things, and I'm blanking on the name of the committee, but it's basically a committee of folks that represent all those different entities, and they're coming together and just being transparent about where funding's going and why.
I mean, it's, you know, we're in, I keep saying it's a growth industry we're in all of a sudden. So if you're in a growth industry, you don't try to keep doing the same things you were doing. You have to build new systems to manage all this stuff. So we need like different types of intermediary roles to be played. And probably stop calling them intermediaries. It's like, I don't know, like we got to call them something else more real to the outside world. But it does feel like we need to articulate what those roles that need to be played are.
Yeah. So we only have 3 more minutes in our scheduled time, and this conversation definitely was rich. I think that folks could enjoy doing more of this kind of stuff, but I wanted to throw it back to you to say, you know, would it be useful to have, you know, just hold a place that's on people's calendars for that ECFC could hold and invite this other state funders so that you can use it as a chance to, like Christine threw out, like, oh, we're working on this and what do other people think? And you guys all jumped in. So I'm wondering if that seems like something we should try to do again. And maybe not after 5 o'clock East Coast time, because I know there were people who are interested and a lot of people said, please record this because I want to listen to it later. If you have thoughts on how we can be helpful in facilitating these cross-state conversations, we'd love to hear it.
Well, I, for one, would like to hear from other state colleagues. I mean, it's been interesting hearing from Shana and Christine. So I think going forward, yes, it would be nice to know, you know, where are we? I mean, our process right now is going well. Who knows if it will continue? What would the lessons learned? But then also to hear from other states as we move forward in terms of, okay, now we've got the stabilization funds going. What's our role going forward as we begin reimagining what our childcare system looks like? And what's the role of philanthropy? What's the balance of, in terms of supporting policy and advocacy groups, grass tops, grassroots, you know, philanthropy by itself in terms of supporting consultation, evaluation, et cetera. I'd be interested in that.
Shana says yes in the comments. Christine, I hope you would be interested too. Kim can't talk, apparently. She says we can't hear her, so.
Yeah, I find these conversations as a new funder in this space be very helpful. So yeah, happy to.
Okay. Well, so we're going to probably look to find a time that could be recurring on folks' calendars, just so, because it's so hard to schedule now. And if you have folks here, since you're part of the conversation, I know I've already collected some of them, but Christine, if you have, and Kim, if you have times that you just know you're never going to be available, if you want to just send them to me, I would be happy to try to find and suggest some times that work for everyone here. And yeah, we learned so much from you and listening to you talk to each other that we thought, let's try this. And it seemed like it worked. Shannon, do you want to say anything else?
No, just that I think that it would be great if we could talk regularly. And as we go through, I think it's good for y'all to have a chance to talk to each other. If there are additional people you want to hear from, like if you do want people to come from the child tax credit side, or the child welfare side and say like what they're, okay, I'm seeing some nodding, like we can figure that out too. We could go out and find examples of people who are working on some of those interrelated programs and invite them to come chat about what they're doing too. So
Shannon, I'd add to that. I'd love to hear from folks engaged in workforce development and higher ed pathways as well, as to just be thinking about how they're thinking about early childhood, and are we making the connection there, and what do we need to do to ensure that some of the workforce development is not, our folks are not forgotten in that pathway. So that would sort of a current issue area for me, but that would be interesting, I think.
Yeah, I was just at a session earlier today with the director of higher education from Rhode Island, who was talking about how they're trying to develop some actually early childhood workforce focus strategy in the state, and working with labor and just really trying to pop this out of like only being seen as a certain kind of issue. And it seemed like, I think you're onto something that people are realizing we don't have a pipeline.
The other thing I'd want to return to is the issue of the broader compensation, not just salaries, but health benefits in terms of group purchasing. The other thing that came up in our funder collaborative meeting today is the Community Foundation for Greater New Haven, through their mission investing effort, is working with local banks around providing housing. You know, the details of it was just referenced. But I know one of the things that it's raised for me is we have a lot of priorities in Connecticut in terms of how we use everything from vouchers to mortgage relief, et cetera. but childcare is not considered one of those. So there might be a veteran's preference, or there might be other preferences. So anyway, the whole issue of thinking a little bit more broadly in terms of compensation and what the role of philanthropy, and I can find out a little bit more about what the Community Foundation's done in Greater New Haven around helping to address housing for family childcare providers, because in many instances, they're challenged by the fact that if they're in a rental situation and their landlord says, no, we don't want childcare in here, or we're getting complaints from tenants or whatever. So that would be another area.
Yeah, and I know we're at 3 past 6, but just one thing that this workforce conversation kind of hit me between the eyes is I've heard from folks in the administration that when it comes to the families plan and getting more money sustained, they are very worried that what if they won it and there was no place for anybody to take the money? What would happen then, right? If there was no workers, if there's not classrooms, so on that happy note, but it comes together with, will we be able to get additional money if they think that people can't spend the money, so.
Yeah, that's sort of my biggest fear is we're going to get all kinds of funding and then we won't be able to open classrooms or centers. And then at the end of the time, somebody will say, see, you didn't use it anyway. And then they don't want to continue it. Whereas pipeline for workforce is a multi-year process to think about how we do this with so many different pieces. And so how do we make sure there's some patience there and some long-term vision around sticking with it? Coupled with the rate reform, because you can't ask people to get better trained and put them in a pipeline with to have better qualifications and then not match that with some sort of compensation. So anyway, ongoing discussion, but yeah, thank you, Shannon, for bringing that up.
Okay, well, I so appreciate all your time and good thoughts and ideas. I tried to take notes, and we recorded this so we can go back and look at it, but we will definitely follow up and have more conversations. If there's things you didn't get a chance to say or ideas that pop into your head while you're in the shower or taking a run or whatever it is you're going to go do tonight, feel free to send them to Shannon and to me, and we'll factor that in our planning. Thank you so much. Have a great night.
Everyone.
Thanks. Good night.